pandemic as well.
The honourable member for Courtenay-Alberni.
Mr. Speaker, first we heard the Conservatives from Fraser Valley rail against harm reduction when in fact they support harm reduction and they support treatment and recovery. There is no war between harm reduction and treatment and recovery. We need them both, Mr. Speaker. So what I'm seeing today is we see the Conservatives spread misinformation, which is costly in a health crisis. But we also see the Liberals take an incremental approach, which costs lives. So through you, Mr. Speaker, I've asked the minister repeatedly to scale up efforts. This is a national health crisis. They're spending less than 1% of what they spent on the COVID-19 crisis and the response to it. We've lost almost as many lives, Mr. Speaker. And we look at the amount of money they spend on the AIDS crisis, on SARS, on other health crises. It doesn't even pale in comparison. So when is the government going to scale up on safe supply? When are they going to get involved in the recovery and treatment on demand? Because we need them to get involved. They can't keep downloading to the provinces. That's where Portugal stepped up, Mr. Speaker. And we need this federal government to scale up with rapid investments so that when people need help, they get it and we meet them where they're at.
The Honourable Minister of Mental Health and Addictions.
Thanks very much, Mr. Speaker. And I thank my colleague for the really important distinction that the polarization of harm reduction versus treatment is extraordinarily unhelpful. We know people need access to treatment at that moment they're ready, but we also know they need adequate aftercare so that they actually don't fall back into the environment that made them sick in the first place. I think that as we move forward, as the member well knows, that there were over $100 million have been designated for safe supply. In this last budget, we received another $144 million in terms of the substance use and addiction programs, as well as the $25 billion going to the provinces and territories, where one of the four pillars is mental health and substance use. And we hope that the provinces will be able to use that on the issues of complex care, the issues of treatment beds, as well as aftercare, and I look forward to working with the member as we tackle this flawed ideology on the other side.